The agency is concerned that the lack of reliable and safe humanitarian corridors in Ukraine is further hampering their ability to respond to the unfolding impacts on women and girls. And with widespread reports of military bombardments in Ukrainian cities and towns, including the attack on a maternity hospital in the southern city of Mariupol, the needs of women in particular remain acute.
Since the start of the war, we've seen a number of maternities that have been bombed. Probably the most recent one is the one in Mariupol that you probably have heard and seen the horrific images that have been on the media internationally. But it's not the only one. In Zhytomyr, the maternity was completely destroyed. In Kharkiv, in one of the areas of Kharkiv that has the largest maternity, the area was completely shelled and the maternity was also destroyed.
Of the over 2.3 million people to flee the country, the vast majority have been women and girls, with most men barred from leaving the country.
In a situation of war, women and girls' needs are often neglected. People think about food, they think about shelter, they think about giving surgical support, which is, of course, extremely important. But then what is often forgotten that women, even in a situation of war, they still get pregnant, or they are pregnant, they need to deliver, or simply they have their periods. And even having a sanitary pad, sometimes it's impossible when you are on the move. And this is where we talk about dignity kits. A dignity kit is something that we provide that includes hygiene items, basic clothes, and sanitary pads, which again seems a simple thing, but they're often forgotten in a situation like the ones that we are facing right now.
As of Wednesday, the World Health Organization said it had verified almost 24 attacks on health facilities, health workers and ambulances as it seeks to establish a pipeline of supplies for health facilities throughout Ukraine.
These attacks deprive whole communities of health care. More than 2 million people have left Ukraine, and WHO is supporting neighboring countries to provide health care for refugees, most of whom are women and children. Some of the main health challenges we see are hypothermia and frostbite, respiratory diseases, lack of treatment for cardiovascular diseases and cancer, and mental health issues.
The UN chief again urging the international community to come together in solidarity.
Peace is the most important global public good, and the United Nations was created to deliver it. War brings death, human suffering and unimaginable destruction at a time when we cannot afford to add to the major global challenges we face. This conflict also calls on us to come together in cooperation and solidarity to support everyone affected and to overcome this violation of international law.
The Office of the High Commissioner for Human Rights reports at least 1,400 civilian casualties, including 516 deaths to date. We are now also seeing widespread reports of mass graves in Ukraine as officials struggle to deal with overflowing morgues and corpses decomposing in open air. Soldiers and civilians often buried without a family member in sight. And with talks between Russia and Ukraine offering little in the form of a ceasefire, Western nations, including the United States, say they continue to collect evidence of war crimes, human rights abuses, and violations of international law. Sherwin Briceby's SABC News, New York.